Good evening, everybody. My name is Maryke. I'm the physiotherapist from sportsinjuryphysio.com, where you can get online consultations with a physio. So tonight's live stream is all about tib post tendinopathy or tibialis posterior tendinopathy. And the things that I'm going to discuss is we're going to look at the anatomy, where the tib post runs and what function the muscle has. Then we're going to have a look at where exactly you feel your pain and how you can kind of know that it is tib post tendinopathy that you have. It's a compression tendinopathy, and I will explain a little bit about why that's important to remember. And then we'll have a look at why it happens. Why do you get this injury? Because as you know, I'm a big believer if you understand why it happened, it's easier to avoid and also to kind of get rid of. And then lastly, we'll look at all your treatment options, because again, it's not a one size fits all. It depends on what caused your case and will dictate how you get yours better. Excellent. So if you've got any questions, pop them in the comments as we go along. But if you're watching this on replay, make sure that you just tag me and I'll get back to you. If you're on Facebook, if you tag Maryke Low, then I'll get back to that. All right, let's get started. So looking at the anatomy of the tib post tendon, the tibialis posterior is a muscle that runs deep inside of your calf. So your calf has several layers of muscle, and it's one of the right deep ones right in the middle of the calf. And then the tendon comes down the back of the tibia, and along the inside, like you can see on that picture, it comes behind the bone, the heel bone on the inside, or your medial malleolus, and then attaches to the side of the foot. I may actually show you that on my foot, because that will make a little bit more sense then. Let me just get this one out of the way. See if I can get this down there. So if you can look at my foot, so the muscle itself sits about in that position, and the tendon wraps around and comes behind your bone there and comes and attaches to the navicular there, but then it comes underneath the foot as well and attaches to several of your little bones under your foot. And it's got an extremely important part to play in controlling your arch, so stopping it from collapsing over or just collapsing flat. And with injuries, maybe if I take this away you can see better, whenever you get a tear of your tib post tendon, you can get that the whole arch collapses and the foot flattens out. So the main things that it does is it helps to maintain this arch form, and it stops the foot from turning in too much. Now when the foot is free, it can also help to point it down, so it does help you to go up on your toes a bit, and it also turns the foot in, and we'll get back to that when we get to the exercises that you can do for it. Now I mentioned that tib post tendinopathy is a compression tendinopathy. Well, it's actually a combination, but there's a big compression component to it, because you can see the main injuring movement is if the foot turns in excessively, or it's either too quickly with too much force or too many times, then the tendon that wraps around here compresses into that bit, and that can cause part of the tendinopathy. It can also just be a plain overload, but the compression component is quite important to control when you treat it, and I'll explain that a little bit more in detail in a minute. So why does it happen? It's any activity that causes the foot to excessively turn in. So if we think of just plain poor ankle stability, so let me see if I can get my foot into the picture a little bit better. There we go. So if you can see that, say for instance I'm a runner, and you know the test where you're on one leg and you do a single leg squat. If your knee doesn't move in a straight alignment and it turns in, can you see how if my glutes are weak, it's going to push my leg in, which makes my foot pronate more. So that can also happen from the bottom. If my foot muscles are weak and my tib post is weak, it can just let my foot turn in with every step I give, even if my glutes are strong. So that's the first bit that's quite important for this type of injury. Now, there are other things as well. Let me just get them on there. The other important one is shoes. So if you think of shoes that's extremely flexible, if they allow your foot to kind of wobble while you're running, Now, for some people that may be fine if you've got a really rigid foot. They like soft shoes. Other people may have really flexible feet, and then that wobble is too much, so that can contribute to that. At the same time, a shoe that's too rigid can contribute to that as well, and that actually caused mine a few years back, where I knew when I bought the pair of trainers that they were too hard and too solid, but I was too lazy to send them back. So I decided to run with them, and I combined it with a lot of downhill running. So what happened was, because the trainer didn't give, it made my foot turn in too quickly on the shoe. So there wasn't any kind of break to it. It made it do a quick turn with the downhill thumping, and that caused my tendon to overstrain. Downhill running, a lot of downhill running, if you're not used to it especially, or if it is towards the end of a long run where you're already tired, that can cause that tendon to strain, because with every step you give on the downhill, it's quite a lot of force through the foot and the ankle. Running on a camber. So where we are, we've got the South Downs, and very often you can find yourself running at that angle. Now, can you see that the foot that's the top, that is at the top, is going to want to turn in with every step you give? So if you're running for miles and miles and miles at this angle, you may cause a strain in this tendon just because it has to control that movement so much, and it may not be used to it. So a good option if you want to prevent it, if you're running on the downs, is try to get it that you at least half the amount of time between which foot takes the strain for being up on the camber. Then there's suggestions in the literature when you look at how people treat it, that overly tight dorsiflexion, so if your ankle can't bend enough forwards, that will cause the foot to turn in as you walk. I have to be honest, I've not seen that as a primary cause in any of my patients. It's usually more down to training error or being too flexible or not having enough muscle strength. But in theory, if your ankles are really tight, you're going to have to invert more to get over that joint. But that's not the first thing I look for. Whenever I do get tight muscles and things in my patients, it often resolves once the pain from the tendinopathy has gone. So I think it's a reactive tightness that you get in the muscles rather than that's actually causing the primary cause. Okay, so to recap before we go on to treatment, the tib post's main function is to prevent the arch from collapsing and from overpronating. And that's when you injure it, is if you do any activities that causes the foot to turn in excessively, or that puts a lot of strain through it. So it could be that your ankle muscles and the other muscles around the ankle is weak. It can be that your glutes are weak, allowing your leg to turn in more. It can be your running shoes. It can be loads of downhill running that you're not used to, or running on a camber, or it can just be excessive mileage when you haven't quite built up to it over time. Like for instance, if you're doing marathon training and you're not that used to it. Good, so that takes us on to treatment. How do you get rid of it? The first important bit is activity modification. Now, what do I mean with that? I mean that you try and find the benchmark of what you can do without aggravating your pain further. Now, we're not even talking about running at this point. We're just talking about standing and walking around, because often my patients find that standing for long periods of time is more aggravating than going for a short run. And that is because as soon as you're on your feet, that tib post tendon has to work to control your arch for you. So if you're standing for hours and hours and hours, the poor tendon works the whole time. So what I tend to tell my patients is, if you do, in those early days when the tendon is really painful, if you don't have to be on your feet, sit down. So if you find that you're going for shopping with somebody or you're waiting for somebody, see if you can sit down, if you don't have to stand. Try to limit your walks and things you do to levels where it doesn't increase your pain. It's okay if it just feels a little bit uncomfortable, but if you end up having a proper ache after you've done something, then that's a little bit too much, and you're just keeping the pain cycle going with that. So find that level of activity, sport as well as day-to-day things, but especially standing, that you can do without aggravating that tendon, so it can have a chance to calm down. Then the second thing that I tell people to get is orthotics. Now, orthotics, let me just go grab mine so that you can see what it is. Yes, so Orthotics is, where's my camera? Basically a device that you put into your shoe. It's like an insole and it supports your arch a bit. So it helps to keep that rounding of the arch. Now mine is specially made for my feet, so they were molded on it. But to be honest, most of my patients get away with just buying off-the-shelf orthotics. Not too hard, because remember, part of the problem with this tendinopathy is it's a compression tendinopathy. So if you put more compression on it, it may actually aggravate it. So I don't tell them to get gel ones, but at least ones that gives a little. Okay. And honestly, at the beginning especially, if you have relatively normal arches, unless they're really, really flat, I don't think you need bespoke ones. You can get away with just off-the-shelf ones. And that is for everybody. Now, some of my patients will be able to wean off them and won't have to use them forever. Take my other half, for instance. He's got really rigid arches. The only reason he got a problem with his tendon a few years back was he gained a little bit of weight and then he jumped right into training, and that caused it to overstrain. So for him, I issued them for a few months, and then he could wean off them when he lost the extra weight and he got used to his running again. Whereas my feet are stupidly flexible and the ligaments just do not support it. So when I run, the poor tip post has to take all the strain. Now, I have strengthened everything else up, but when I get tired, that's when my tip post tendons just can't stand it. So I find it's just best if I keep my orthotics in my shoes. So that will very much depend on your specific case. But at the beginning, to calm it down, it really helps if you can give them that little bit of a crutch. Hand in hand with that goes good shoes. Now, too flexible shoes will make you wobble with every step you give, so the tendon will actually have to work a little bit harder. Shoes that's too tight, even that low-grade compression. I remember when I had mine, I stand some days for between 8 to 12 hours on my feet doing physiotherapy. And I remember my feet were killing me at work. I was fine going for little runs and at home, but it was just that. And then I realized my trainers were just too tight. It didn't like that low-level compression throughout the day. So as soon as I loosened my trainers off properly, then I found that actually I could cope with the standing. So see if you can get away with it, wearing shoes that's supportive, but don't actually give you any pressure, even very light pressure over that area. If you can really loosen your shoes, you may find that that helps at the beginning. Later on, of course, you need to tie them properly that you can get the support from them. Stretches. So in the literature, they often include in the treatment programs calf stretches and even soleus stretches that you do with a bent knee. I want you to be careful with these, especially if you've got a fresh injury and have just aggravated your tib post tendon. Those type of stretches also wraps that tendon tightly around the bones of the foot, and more often than not, I find my patients actually flare themselves up with those at the beginning. So if your calf muscle feels really, really tight, a safer option with that you won't cause that compression may be if you actually do some self-massage on the calf muscle. But I'll get on to that in a minute. If you've had your tendon pain for a while and you want to try some gentle stretches, go for it, but just don't stretch it too hard at the beginning. Okay, so ease into it. Check your 24-hour response. Because remember, tendons often only tells you the next morning that you've overdone it. So whatever you introduce it very gently and be critical about it. So make sure you check, do I actually feel better after this? Or does it increase my pain dramatically? But yeah, stretches is not my first line of defense for this or first line of treatment for this, but you may find it useful. Some people do. With regards to the massage, don't go and roll over this bit that's so painful, because what I also found when I really made mine angry, I got a really, it can be nearly a burning pain that you can feel over this part of the tendon. And to be honest, when I'm injured, I turn into a little bit of a typical runner. And you get to the point where you're so fed up with it, you think, I'm just going to get in there with a massage ball now. I can honestly tell you, you will make it feel worse if you go and really nail that bit of tendon that's already sensitive and sore. So whatever massage you do for yourself, you can do it firm, but gentle. It shouldn't cause you more pain afterwards. So ease into it again and see what it likes. If it's a tendon that's just flared up, within the last few days or week, I wouldn't do massage over it. I would just do activity modification and get it to calm down, support it and give it some rest there. That leads us into strength training. Now, all tendons and tendinopathies needs to be strengthened up afterwards to regain their full strength. The tib post tendon can be quite fickle when you try to strengthen it. So typically people get you to do exercises with exercise bands turning in and out. I want you to leave those until the tendons calm down a little bit first. The things you can work on so long is good strength in your glute max, your glute med, because remember, they control how much your leg turns in, and if you can get good stability over the top, around the top of your hips, then you will actually offload that tendon. You can do exercises to strengthen the intrinsic muscles of the foot so long. So things like, let me just get a thing here. Let me demonstrate. Up. If I can get my foot here. So if we think of exercises that can strengthen the other muscles inside of the foot, there's things like this type of thing where you're gathering a towel up. Now, I know it looks like a very simple exercise, but I can tell you, if this tendon is really painful, that may be all that it can cope with at the beginning. And that's okay, because it helps to get the arch and the other muscles going. Then, if you are going to do the exercises with the exercise band, you tie the band around something that won't move. So I tend to use my bed because it's the heaviest thing I have. It actually works quite well if you put it through a door with something to keep it stuck on the other side. Let me just get this tied up. So actually I'm going to take this thing out of the way for now. If we take my right leg for instance, so the tib post does that movement. So it turns it in and points the toes down. Now, if the foot moves totally out, all the way back out, the tendon wraps around the foot there. So if you're going to allow it to come back all the way at the beginning and the tendon's really sensitive, it may not like that. So what I get my patients to do to start with is they put it around the foot and I actually just get them to take it into that position where it's turned in, and then they move their bodies away so that the foot has to work against the band, but the foot's not actually moving. Okay, it's my body moving away that's creating the force there. And I just get them to hold it. And you start with something like 10 to 15 seconds and then relax it all and you rest again. Then you turn it in and you can point it down a little bit also while you turn it in, and then you turn your body away again to get that isometric strength. So what we're doing is we're asking the muscle to tense, but we're not taking the muscle into that position where the tendon can go again, get wrapped around that bit. So that can be a good way in the initial phase to start strengthening it without flaring it up. Now, the research has also shown that when you get that type of injury, usually the other muscles around the ankle is also weak. So the tib ant, which you can strengthen by, again, having a elastic band, and then this time round we are going to pull up. So you want to squeeze your toes and you're going to slowly go up and down with it, but you may want to tie it better around your foot that it doesn't actually want to slide off. What I find useful is I often wrap it through my laces so that it stays stuck there, and then I can move my foot in any direction and it doesn't actually come off. So that may be a better option for you. And then also the outwards movement of the ankle, but to be honest, when this is really painful, I would leave that for when that's actually calmed down a bit more. The other important one to strengthen is the calf muscle complex in itself. And that's your simple exercises like where you go up and down on your toes. Now, word of caution again, in a very painful tib post tendon, that type of movement can really aggravate it. So usually how I structure my program is, if you come into the office and you've just aggravated your tib post tendon in the last week or two, I get you to first modify your activities. So I get you to think about how much walking, running, things like that you can do without increasing the pain and getting it to calm down to a level. Once we've got it that is not that painful day to day, then we start introducing some exercises for that tendon itself. So we'll probably start with those isometric ones where you just pull it in with a band and move your body away. And if it copes with that, then after a couple of weeks we may add in the heel raises, but just to floor level, not over a step yet. Because if you're going to drop over a step, you're again going to wrap that tendon around the foot, and it can cause it to become aggravated. You want to progress that to where you can do it on one leg eventually, and only after that you'll progress it onto a step. But remember that you've got to include things for your glutes and things as well. Now, when we look at running, I can tell you from experience that you can get away with running long before the tendons have fully recovered, as long as you're clever about it. So the things that I found worked really well for me was, if I say, for instance, it's my right tib post tendon that's the problem. So if you think of it, right foot, left foot. If I run with my right foot at that angle, it's going to turn in more. So that's going to cause more pain. However, if I choose the side of the road that makes my ankle run like that, can you see that the road will naturally stop this foot from turning in? So it's going to act like an extra orthotic, stopping it from turning in. And I have found in the past that I could run without pain and without aggravating my pain later if I ran with my foot in certain positions, not trying to keep it there artificially, but actually the terrain keeping it there for me. And that was a good way to keep my fitness up. I couldn't do miles and miles and miles, but I could get away with something between 3 and 5 kilometers, which was just enough to keep my sanity at that point. Other things that help is, if instead of running on flat terrain, I found at one point I was better off running on slightly more hilly terrain, or terrain which made me step lightly. So for instance, I remember that holiday we actually went to Costa Rica. And I was devastated because I developed it just before we went, and I really wanted to run there. And I think it was day 3 or something that I decided, I'm just going to give it a go. And the funny bit was, because it was gravel road and quite big rocks in the road, I had to be quite light-footed. So I didn't have time to do my normal plonk, plonk, plonk. And I found that I could run because I never allowed my style to collapse, or my foot to collapse. I didn't actually go into the point where the tendon was strained. So by keeping my feet light and my steps nice and light, I could get away with running again. So there are loads of little things that you may be able to change that you don't strain that tendon while you're running. And if you can do that and you don't have any more extra pain in the next 24 hours, then you're welcome to do that type of running that you're doing. Excellent. So let me know if you've got any questions. To just give you a quick overview again of the treatment and everything that you need to think about. So, tib post tendinopathy, the tib post stops your arch from collapsing and your foot turning in. So any activity that makes that foot of yours sweep in more than normal will cause the pain to start. So it can be too flexible shoes, it can be loads of downhill running, it may be weakness around your ankle, it may be weakness around your glutes. You've got to identify what it is so that you can work on that specifically. And then the cornerstone of treatment is figure out what activity level you can do, and that goes for standing, especially just day-to-day things that doesn't aggravate it. Get some orthotics to support it. Make sure your shoes that you wear day-to-day does not press on that tendon and supports it enough, because otherwise you will keep the pain going even though you're not doing anything else to annoy it. Then stretches, do it if it helps, but be careful, it can often annoy it. Massage, don't hammer too hard, you can make it feel worse, but some firm massage that's comfortably uncomfortable could help. Strength training, you've got to strengthen your glutes, glute med, as well as around the ankle. But again, let it calm down a little bit first before you go into heavy resisted movements. Start with some light stuff first. And then running, if you can adapt it in a way that it doesn't strain the tendon, so choosing the right side of the road or quick light feet, you may be able to do that while you recover. Excellent, Vicky. Oh, cool. I'm glad you're finding it informative. Good. So if any questions come up after I've said goodbye, then just pop them in the comments or feel free to message me. And if you want a specific rehab program and want to talk yours through with me, you're welcome to book an online physio consultation. Link is in the comments or in the description. Take care, guys. Bye-bye. Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.